Hello everyone, welcome back to Speak Healthy. Today, we're going to talk about peripheral artery disease and some different ways we can fight against it. Peripheral artery disease, or PAD, is a common yet underdiagnosed condition that affects so many people around the world, especially those over the age of 50. It occurs when fatty deposits build up in the walls of the arteries that carry blood to the limbs, causing them to narrow and reduced blood flow. If left untreated, PAD can lead to serious complications such as limb amputation, heart attack, and stroke. However, the good news is that there are several effective ways to reverse PAD and improve your overall health. In this video, we will explore the various treatments and lifestyle changes that can help you manage and even reverse peripheral arterial disease. Number 1. Lifestyle changes. Lifestyle changes play a crucial role in managing and reversing peripheral artery disease. Quitting smoking is one of the most important steps you can take to improve your overall health and reduce your risk of complications from PAD. Smoking damages the walls of your arteries, making them more susceptible to blockages and reducing blood flow. By quitting smoking, you can reduce inflammation and improve blood flow to your limbs, which can help to alleviate symptoms and prevent further damage. Exercise is another essential lifestyle modification that can help to reverse PAD. Regular exercise can help to improve cardiovascular health, increase blood flow, and reduce inflammation. It can also help to lower blood pressure and cholesterol levels, which are risk factors for developing PAD. Your healthcare provider can help you develop an exercise plan that is safe and effective for your individual needs and abilities. Following a healthy diet is also important for managing and reversing PAD. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins can help to reduce inflammation and improve cardiovascular health. You may also need to limit your intake of saturated and trans fats, as well as sodium, to lower your cholesterol levels and reduce your risk of high blood pressure. In addition to these lifestyle modifications, you may also need to manage other health conditions that can contribute to PAD, such as diabetes or high blood pressure. Number 2. Medications. Medications can be an important part of managing peripheral artery disease and reducing the risk of complications. There are several different types of medications that may be prescribed depending on your individual needs and health status. Antiplatelet drugs such as aspirin or clopidogrel are commonly prescribed for people with PAD. These medications help to prevent blood clots from forming in the arteries, which can reduce the risk of heart attack or stroke. They work by interfering with the function of platelets, the small blood cells that help the blood to clot. Cholesterol-lowering medications, such as statins, can also be prescribed for people with PAD. High levels of cholesterol in the blood can contribute to the buildup of plaque in the arteries, which can worsen the symptoms of PAD and increase the risk of complications. Statins work by reducing the production of cholesterol in the liver, which can lower cholesterol levels in the blood. Medications to control blood pressure may also be prescribed for people with PAD. High blood pressure can put extra strain on the arteries and increase the risk of complications from PAD. Medications such as ACE inhibitors or calcium channel blockers can help to lower blood pressure and improve blood flow. Other medications that may be prescribed for people with PAD include medications to improve circulation, such as cilostazol, or medications to control blood sugar levels for people with diabetes. Number 3. Angioplasty, atherectomy, and stenting. In the treatment of peripheral artery disease, angioplasty, atherectomy, and stenting are minimally invasive procedures that can help to improve blood flow and relieve symptoms. Angioplasty is a procedure in which a catheter with a small balloon at the end is inserted into the affected artery. Once the catheter is in place, the balloon is inflated, which helps to widen the artery and improve blood flow. In some cases, a stent may also be inserted into the artery to help keep it open. Atherectomy is a similar procedure in which a catheter with a rotating blade or laser at the end is used to remove plaque buildup from the walls of the affected artery. This can help to improve blood flow and reduce the risk of further blockages. Stenting is a procedure in which a small metal mesh tube is inserted into the affected artery to help keep it open. Stents may be used in combination with angioplasty or atherectomy, or they may be inserted on their own. All of these procedures are performed using a catheter that is inserted into the artery through a small incision in the skin. They are generally considered safe and effective with a relatively low risk of complications. However, like any medical procedure, there are risks involved, and your healthcare provider will discuss these risks with you before the procedure. After the procedure, you may need to stay in the hospital overnight or for a few days to be monitored. You may also need to take medications such as antiplatelet drugs to prevent blood clots and reduce the risk of further blockages. Number 4, surgery. In some cases of peripheral artery disease, lifestyle changes, medications, and minimally invasive procedures may not be enough to improve blood flow and reduce symptoms. In these cases, surgery may be necessary to remove blockages or bypass the affected artery and improve blood flow to the affected limb. One type of surgery that may be used to treat PAD is endarterectomy. This procedure involves making an incision in the affected artery and removing the plaque buildup that is causing the blockage. The artery is then repaired and closed, allowing blood flow to flow more freely through the artery. Endarterectomy is typically used for blockages that are located in larger arteries, such as the carotid arteries in the neck. Another type of surgery that may be used to treat PAD is bypass surgery. This procedure involves using a graft or a small piece of blood vessel taken from another part of the body or a synthetic material to bypass the blocked or narrow artery. The graft is attached to the artery above and below the blockage, allowing blood to flow around the blockage and to the affected limb. Bypass surgery can be done using either open surgery or minimally invasive techniques, depending on the location and severity of the blockage. In some cases, a hybrid approach may be used, which combines open surgery with endovascular techniques such as angioplasty or stenting. Surgery for PAD is typically reserved for more severe cases, and the decision to undergo surgery should be made in consultation with a healthcare provider. After surgery, it's important to follow your healthcare provider's instructions for recovery and care, including taking medications to prevent blood clots and managing other health conditions. You may also need to undergo follow-up testing to ensure that the surgery was successful and that blood flow to the affected limb has improved. Number 5, alternative therapies. While lifestyle changes, medications, and medical procedures are the mainstay of treatment for peripheral artery disease, some people may also benefit from alternative therapies to help improve circulation and reduce pain. Acupuncture is one such alternative therapy that may be helpful for people with PAD. Acupuncture involves the insertion of fine needles into specific points on the body with the aim of stimulating the body's natural healing processes. Some research suggests that acupuncture may help to improve circulation and reduce pain in people with PAD, although more research is needed to confirm these benefits. Massage therapy is another alternative therapy that may be helpful for people with PAD. Massage therapy involves the manipulation of soft tissue, such as muscles and tendons, to help reduce tension and improve circulation. Some research suggests that massage therapy may help to improve blood flow and reduce pain in people with PAD, although more research is needed to confirm these benefits. Other alternative therapies may be helpful for people with PAD, including meditation, yoga, and Tai Chi, which can help to reduce stress and improve circulation. Some herbal supplements such as ginkgo biloba and horse chestnut have also been studied for their potential benefits in improving circulation and reducing symptoms of PAD, although more research is needed to confirm these benefits and to ensure that these supplements are safe to use. As you've learned, Peripheral artery disease is a serious condition that can cause significant discomfort and increase the risk of complications such as heart attack and stroke. However, there are several effective treatment options available for managing PAD, including lifestyle modifications, medications, minimally invasive procedures, and surgery in more severe cases. It's important to work closely with your healthcare provider to determine the best course of treatment for your individual needs and to regularly monitor and manage your condition to prevent further complications. By taking an active role in your care and making positive lifestyle changes, you can improve your quality of life and reduce the risk of further health problems.